Be quiet.
Let's start over. Okay, we're going to do palpations of the knee. These are going to be our ligaments in red, our bones in green, and our muscles in yellow. Muscles and tendons. Okay, first we're going to start with the medial femoral condyle. You can see it as a bump right here on the inside of the knee. Okay, so this would be his medial femoral condyle. Then lateral femoral condyle is going to be outside of the knee, right here. Medial tibial condyle is the next bump down here. Lateral tibial condyle is down here. Okay, our Palpations serine is an area of the medial tibial condyle, and it's right in here. This circle area here is the Palpations serine. Then we have Gerdy's tubercle, which is a bump on the lateral femoral condyle, and that's this bump you can see sticking out on Matt. That's his Gerdy's tubercle. Okay, your tibial tuberosity is the next bump you'll see. In some people that would be very prominent when they have Osgood-Schlatters, or they had Osgood-Schlatters as a kid. Then we have our lateral joint line, and that's found by palpating at the end of the femoral condyle and the top of the tibial condyle, and that joint line is in between them. Okay, so I'll put that as a red area. No, I will not. Okay, so this in between these two is the joint line. Okay, then we have the medial joint line, and you do the same thing. You go to the end of the femoral condyle and the top of the tibial condyle, and that space there is the joint line. Okay, then we have the superior patella pole. So the top of the patella is also called the base or the superior pole. The bottom of the patella is called the inferior pole. Okay, or the apex, either one. Okay, then on the side here, you can see his fibular head sticking out. That is the top of his fibula and his fibular head. Okay, the ligaments that you can palpate on the knee are the medial collateral ligament, the MCL, and it goes from the top of the femoral condyle to the bottom of the tibial condyle, and it sits right on the medial side of the knee. Anywhere along this area is the MCL. Okay, then we have the lateral collateral ligament. It is the same thing. It goes from the top of the lateral femoral condyle to the bottom of the tibial condyle and sits right along that area. Right along the joint line is where you can palpate it. Another easy way to palpate it is to take them into a figure 4 position and palpate along the side. You'll feel a ropey area there. Okay, then in our joint lines, what you're palpating are the lateral and medial meniscus. So if you go back to your joint line over here on the lateral side, you know that the lateral meniscus is in that joint line. So as you go across the joint line, you're palpating the meniscus. Same thing on the medial side. If you go along the joint line, you're palpating the medial meniscus. Okay. Then we have several bursa in our knee, which I'll also represent with the red. The suprapatellar bursa is above the patella. It sits underneath the gastroc muscle and is right here. Then you have the prepatellar bursa, which is on top of the patella, right on top of the kneecap. Okay. Then you also have a Palpations serine bursa, which helps the tendons that come through that area glide around. So right here you have a Palpations serine bursa. Okay, then you have a patella tendon. It can sometimes be called the patellar ligament. It goes from the apex of the patella, or the inferior pole, to the top of the tibial tuberosity. And it sits right here. It is the whole group of quadriceps come and engulf the patella and come down and attach on the tibial tuberosity, making the patellar tendon. Okay, now muscular points, we have on the lateral side the vastus lateralis. That's your first quad muscle we're going to talk about. So your vastus lateralis sits on the lateral side. Then you have your rectus femoris. It starts up in your hip at the AIIS, which is the bump you cannot feel on your hip. And it goes down and makes the quadriceps tendon into the patella. Okay, then underneath of that you have your vastus intermedius. You will not be able to palpate that. It is directly under the rectus femoris. So the next one you'll be able to palpate is the vastus medialis. And remember, at the end of that you have your VMO, your vastus medialis oblique, and it sits right here. And when he squeezes his quad, you can see it. This area here is his VMO. Okay. Now your adductor longus is going to start up in your groin and come down and attach right in this area here. Okay, you're probably not going to be able to tell the difference in palpating it, but you just should know that it goes from up in the groin to right here. Then your adductor magnus is a much larger muscle, and it again comes down and attaches down here into the adductor tubercle, which is right behind here. Okay, the one that you can really palpate is the gracilis. It runs this whole length here and comes down and attaches into the pes serine. So anywhere on this path is your gracilis. It attaches into the pes serine, remember. Okay. We also have our sartorius. It starts up here in the ASIS and crosses the leg like this and comes into the pes serine. Okay, so anywhere along that path I would accept. From here, along here, into the pes serine is the sartorius. Remember, its job is to do the polka. It brings your leg up. Okay, your tensor fascia lata is the muscle that starts your IT band, and it starts up here in your hip. It goes into your ASIS as well. So your tensor fascia lata really starts up here. But then it comes down and makes your IT band, which comes down along between the quadriceps and the hamstring. This area here is your IT band. And it attaches into Gerdy's tubercle. Okay, so anywhere on this path is IT band, or down here on Gerdy's tubercle is where it attaches. Okay, now we have our hamstring muscles. So if we can get him to flex his hamstrings, you can see this one popping up here. It stops short. That is his semimembranosus. Okay, then the semitendinosus follows that same path and comes around and attaches into the pes serine. Okay, so it's just on the other side of it, but it comes around and attaches in the pes serine. Now his biceps femoris has two heads, the long head and the short head. You can see both of them sticking out right here. And they come around and attach in the fibular head. Okay, so this right here is his biceps femoris. Okay, then we have our gastrocnemius, as you guys have learned from the ankle. Okay, the gastroc goes here and attaches up here on the femoral condyles. Remember, this is the medial femoral condyle, this is the lateral femoral condyle, and the two different heads come up and attach right here.